Hello, I'm Professor Yang Seung-min. When we place an implant, suturing is not simple. Depending on cases, various suturing methods can be used. How skillful you are at suturing can make a difference in the outcome of implant procedure. Let's learn various suturing methods for clinical cases. The contents. First, I'm going to talk about the principles of various suture techniques, instruments for suturing, and suture materials, suture methods, and summary. First, principles of suture techniques. For successful soft tissue management, incision, flap management, and suture, these three need to be done. For successful soft tissue management, the last step, suturing. The purpose of suturing is to close the wound. And additionally, it is to adapt flap margin. The margin can be heightened or lowered to change the position of a flap. Principles of suture technique. First, you need to position a needle holder properly for suturing. This is the starting point of suturing. If this is not done properly, entry cannot be made in a proper place. Then, when we pull on suture thread, the thread can be broken. So, a needle holder should grip or hold the needle properly. After that, we need to enter into the tissue surface perpendicularly. The suture needle should pass through the tissue according to the curvature of the needle. We need to hold the insertion point at the same distance, about 2 to 3 millimeters from the incision line. That is very important because it is the starting point of suturing. During surgery, the flap can be fixed or in some part it can be free, and there is a thin or thick part. So you need to pass through from thin to thicker one and suture from a free side to fixed side in the flap. If you adhere to these principles, you can prevent the suture material from tearing the flap. Most importantly, the suture needle, the depth of the entry into the tissue should be greater than the distance from the incision. 2 to 3 millimeters is a bit too close, so the distance should be 4 to 5 millimeters. And the principles can have modifications depending on the purpose of suturing. If you observe the principles, with some modifications if necessary, it will work. Let me talk about the instruments for suturing. First, the surgical needle. It is composed of mostly body and the point, the end, the entry point, and swage, which is connected to suture material. Needle radius, diameter, and length are indicated in the suture material. You can refer to that. Types of needle holders. There are many different types: Hegert type, Matthew type, and Castreview type. They have characteristics. Hegert type is mostly widely used for detailed or delicate suturing or for patients with a small mouth opening. Castreview type can be used. A needle holder, as I said before, should hold accurately 1/2 or 2/3 of the needle accurately. If it is closer to needle point or swage, the needle can be deformed. You need to be careful about that. From the tip of a needle holder, the needle should be grasped 2 to 3 millimeters from the tip of the holder. So suture needles should be grasped so that it doesn't get deformed. How to grip needle holders? Most basically, classic thumb ring finger grip. This is widely used. So fingers are inserted into the rings of a holder. The second method is thumb index finger grip, like on the right. Pen grip. For Hegert type and the Castroviejo type, the needle holder can be gripped like this. As you can see, when suture needle is gripped with a needle holder on the left, that's most appropriate. And you can see the needle is shaking on the right. When the needle holder does not match with the needle that happens, the middle one, the needle holder is too large for the needle, and C indicates needle holder that is too small for the needle. Therefore, you need to choose needle holder that is appropriate size for a needle. Suture needle is connected to a suture thread. So we need to understand the suture materials that is set with a needle. Requirements of suture materials: it should have an adequate strength, it should be easy to handle, and it is approaching into tissue, so it should have less tissue response. It should be biocompatible, and the knots should be well maintained. If it is of too high tension or too soft, the knots cannot be well maintained. So for a specific purpose, the knots should be maintained. Of course, they need to be sterilized, and they need to be economical. For us to choose 10 to 12 diameters. 10 is the thickest and 12 is the thinnest. There are differences between oral and head and neck. You could use 4 or 5 or 6 in a mouth and 3 or 4 zeros, thicker ones in skin. If you look at here, there are many different types of suture materials. From silk to chromic cut, there are a variety. Can you tell the materials? I can tell some of them, but not 100%. So you need to understand the information provided with the suture materials. The reason why I'm showing you this is that there are many different materials, and it is important to choose a right one. If you try to guess with the picture on the right-hand side, number 1 is silk, and number 5 is a suture material made of EPTFE. In the middle, polyfilament or monofilament type non-resorbable or resorbable suture materials. These are the sections of the materials. One thread is the monofilament. Polyfilament is composed of many monofilaments. A braid is like a hair braid, so monofilaments are braided together. When you do suturing, one of the most important things is that you need to stabilize the knot. When you do suturing, if you make multiple loops at the beginning, the knot of suture material is stable, but if you make 2 or 3 loops, the knot can be released. So our desired tension cannot be applied to a flap. In that case, we need to lock a knot. So on the right hand side, it shows a locking of knot, but there are other ways. And in the hands-on, we will look at what those are. Suturing techniques. There are many different techniques. And if you look at here, there are so many suturing techniques. Do we need to understand all of them? It would be good if you understand all of them. But as everything else, the most simple thing would be the best approach. There are many different suturing techniques, but the most basic one should be mastered, and after that, if necessary, like those in yellow, can be necessary. Then later, we'll be able to close an wound using the techniques. Now, let's go into various suture methods. First, we need to master the simple suturing. As I said before, the principles of suturing are applied here. If you follow the principles, the simple suturing can work in most cases. If you look at the figures, as I said before, there should be 4 to 5 millimeters enough distance from the incision. It can vary depending on the margin position. It can be shorter or longer, but in general, 3 or 4 millimeters or 4 to 5 millimeters away from the incision line. At the beginning, you need to go into the flap from outside, and then from inside to outside to hold the flap. If you look at the figures, these are the modifications of interrupted suture technique. So this is called figure of 8 because it looks like number 8. Before we went into the flap from outside and then came out. But here it goes into the flap from outside and goes to the other side and goes into the flap again. Pressing down the flap. Let's look at a clinical case. The implant is exposed. GBR is done. And primary closure is achieved using the basic suturing. And wound closure was achieved. Another method, interproximal part of an implant or flap can be pressed down or it can be everted. And at one point, the suture can be applied. It is the vertical matrix suture. In the mesial and distal interproximal area, the suture can be applied. And another suturing, at one point in a wide area, a wound can be closed using horizontal matrix suture. After extraction, implants are placed. for tight closure of an wound. Interproximal vertical mattress suture is applied. You can see X. This is a kind of suture that I will explain later. The horizontal mattress suture, the suture material, depending on the technique, the flap can be everted or pressed down. For general GBR, everting is used. When it is everted, the flap can open. You can use this technique to have the suture material pass through the loop on the other side to hold it. Then mattress suture is combined with interrupted suture. So that is a modification of horizontal mattress suture. Here, in the middle, the horizontal mattress suture is applied, and over it, through the loop, the suture material passes through and it gets pulled again. So horizontal mattress suture is modified. There are many different suture techniques. In the past, to close extraction socket, the flap can be pressed down and the membrane can cover the site. And one of them is crisscross suture, the letter X type. Broadly, this is a modification of horizontal mattress suture. After extraction, socket preservation technique is used, and membrane is applied to hold the membrane from the outside of the flap. It is pressed down. Can we press it down from inside? Yes, we can. So from inside, not outside. It is not visible from outside, therefore it is called hidden X suture. This is an adaptation of horizontal mattress suture, and we will learn about this a little bit later. After extraction, socket preservation technique was used. After that, it was sutured. If you look at the magnified picture, there's a left side and right side of the extraction socket. On the left, membrane is applied, and using suture material, it is pressed down. And if you look at the right hand side, X letter shaped suture material goes inside. So crisscross suture is seen from outside, but this is inside. So it is called hidden X suture. The exposed suture material, it went through the interproximal area, but here it goes through buccal and palatal side. How it passes through the flap, X is inside, however, outwardly it looks different. So this is also a modification of horizontal mattress suture, and you can learn this from hands-on. One of the most important sutures is the periosteal suture. Many doctors feel this is quite challenging to learn because it is a suture on the periosteum. Periosteum is very thin, so there is a risk of tearing when a needle goes in here. So you need to utilize the curved portion of the needle, and you can do it quite simply. As you can see, the needle passes through the periosteum according to the curvature of the needle without tearing. And it goes through the flap, and you can modify the upper part a little bit without going through the flap, reducing the tearing. If you look at this clinical case at the bottom, you can see the appearance of an implant. Keratinized gingiva does not exist buccally, so apical reposition, the flap is made and that portion is sutured. After healing, compared to pre-op, vestibule has become deep and keratinized gingiva is secured after it is being healed. And after prosthesis is delivered, the advantages and disadvantages of each of them will be discussed later at another opportunity. In general, people tend to overlook stitch out. When is the appropriate time for it? According to a textbook, in about a week or 10 days. When tension is free or when it is healed, depending on authors, it is different. But generally it is 1 week after. The healing is not completed. When we remove the suture, mistake can be made, like on the right. The attached tissue can be detached. So when we remove suture, we need to be careful. Okay, everything is good. We talked about suture skills and materials. And what is the most important thing? The last one, tension-free flap is the most important part. Tension-free flap. Simply put, it is a periosteal releasing incision can be used to make a tension-free flap, and the flap can be sutured tension-free. Summary. There are various suture methods. The purpose of using suture is to close a wound. Whatever method you may use, wound closure is the most important thing. To achieve the purpose, we need to understand the instruments of suturing, and the most important part is to achieve tension-free flap. Regardless of suture techniques, we can achieve a primary healing. So today we looked at various suturing techniques. How was it? The most capable person is the one who learns in earnest. Try to learn various suturing techniques so that you can be a capable surgeon for patients. I will come back to you with another subject. Thank you for your listening.